Let's do a core workout. This is Open Mind Alexander Technique. I'm Jess. This is part of my exercise and workout series. Other things in this series includes looking at how you can use things like household objects around your home as part of a workout. We're also looking at standing on one leg, doing balancing exercises. We're looking at endurance challenges, all sorts of good stuff. This originally comes from a viewer request. A couple people actually have asked for this. I'm still going to say no, I'm not going to give you any particular, exercise plan that you individually should do, because that's not what Alexander Technique is and that's not what I'm qualified for. What I can give you is a look into, if you're going to do these exercises, how can you do them well? Because my specialty is working with habitual movement, body mechanics, injury prevention, all of those good things. That's what I'm qualified to talk about. So let's look at some elements of a core workout. We're going to start with the most basic one that most people are going to be generally adding in if they're thinking about, okay, I'm doing a core thing, what's that going to involve? Definitely some crunches at the very least. So let's look at how we're doing these. So as I'm going to lay down here, first of all, I'm going to be deliberate about what I'm doing with my hair. Now, in this case, I happen to have just gotten a haircut, so my hair is a little bit different than it normally would be, or than it was previously. But I often will put my hair into a low braid so that there's nothing in the back of my head that's going to be in the way. Part of why I didn't today is I like how the ponytail works a little bit better on camera, and I'm filming multiple videos today. And I'm not going to be here for very long. I'm not actually doing a full workout as part of this demonstration. So that's something to keep in mind. Depending on the depth and height, I guess, of your hair behind your head, that actually might push your neck into a kind of awkward angle. Or conversely, if there's nothing there at all, you might have a situation where your head is really dropping down very far, and depending on your proportions and how that feels for you, either one of those might be problematic. So it's just something to keep in mind, considerations for you and what you need as an individual. So as I'm going into something like a crunch, what is the purpose of a crunch? It is to work the muscles on my abs, more so upper abs than lower. We'll look at lower ab stuff in a second. My upper abs here are shortening a distance between my chest all the way down to my belly. And when I deliberately shorten that distance, that works the muscles, and that's what provides the exercise. So as I'm doing this, things to keep in mind. My goal is here. My goal is not in my neck. I can do other neck exercises, but this isn't one of them. The reason that matters is because if you're doing most of your work by asking your vertebrae to bend at a really sharp angle, you have a pretty high likelihood of ending up with some pain and stress in your neck as part of this process. So if you find that your neck hurts while you're doing crunches, perhaps consider using your neck differently while you're doing crunches. So for me, the way I like to do this is I'm thinking about a very gentle curl from my abs up. And for me and my goals, I'm not going to use my hands at the back of my head. What I normally do with my hands is I just kind of point my fingers at my ears, and I'm going to be here. I'm going to do my crunches fairly slowly because my goal for myself involves a lot of stability and endurance-based training, which is what I really want to focus on. So I'm going to go at this speed. I'm not doing 2 crunches a second here. This is about the speed that I'm going to go at, and I will only do about 30 at a time. And from there, I might do 2 or 3 sets of those spread out across a workout, but I'm not really going to hit more than that at a time because I find that starts to get into burnout and joint stress from my hypermobility. So that's forward crunches. I also will do side to side. Again, going quite slowly. I'm just going to kind of point my fingers at my ears. And what I'm thinking about is aiming my elbow at the opposite thigh. You can either do this one side over and over, or you can alternate. But again, being conscious of what is your neck doing, and can you ask for a gentle curve along this whole crunch pattern so that this is really what's doing a lot of work, and you're not asking for a really sharp, unnecessary, potentially harmful bend by trying to like tuck your chin to your chest as you're doing this. So what about low abs? That's going to come a little bit more from things like leg lifts and stabilizing here. But we have to do this in a particular way, and that's really going to start with pelvic tilts. A lot of this information that I'm giving you comes from Mayo Clinic's Chronic Pain Rehab Center, or the Pain Rehab Center program, so it's their chronic pain rehab program, which is what I did. This is what got me out of my wheelchair. I did that quite a few years ago at this point. I guess it's been 7 years now. I was fully wheelchair bound when I went in, and learned a ton about how I can manage myself and how I can use a lot more consistency in exercise versus bad pain days versus good pain days, and all of those good things. So that's where a lot of this comes from. This was my physical therapy for many years. So pelvic tilts is basically flattening out your back by tucking your tail under as you're lying down. You're going to really feel that. If you're doing it right, you're going to really feel it deep in your abs, low abs here. Because what you're doing is you're using the deep stuff way down in your gut to pull the tail up and under. And I'm going to hold it there for a couple of seconds and then let that relax. The longer you hold it, the harder it's going to be. So once you can do pelvic tilts, holding that, and this is one of the ones where, like, if you can't do straight leg lifts, start with the pelvic tilts. Hold it for a couple seconds each, do 5 of them. Start there. From there, we can go into holding this tilt and holding that stability while doing a leg lift. Especially on the way down, don't let your back arch as you're doing this. So here's letting that relax. You see how that on me especially will really make my back arch, and I can fully like stick my whole arm under there. I'm going to keep that flattened so that I'm really activating the part of my body that I'm trying to exercise. I have a goal here. I know what it is. I'm going to stick with that goal. It's this. How do I activate this? By keeping my back really flat to the ground, even as I lower my legs. That's the hard one. From here, ways to increase difficulty on this, and what I normally do with it is to just combine this with crunches. So tilt, activated, up, and then a crunch up to reach and touch my ankles, because this is hitting both. So this is my normal, like, I will hit all of the abs at once exercise. It's unbelievably difficult. I can only do like maybe 5 of these at a time. So this is what I've been working with recently. So that's a good one you can do. Other options for core, of course, is bicycles. I can show you what the bicycles look like. Bicycle exercise or bicycle kicks. I'm going to fully go until my elbow touches the opposite leg and just back and forth. So this really hits our twisty muscles in the torso, obliques, and various other twisty things. It's important to remember that as you take a breather for a second, don't collapse. Because what that is doing is it's enforcing in you that relaxation equals collapsing. And then you're going to end up collapsing and going into unhelpful places every time you're trying to relax. Relaxing comes from being well organized. Relaxing comes from not needing to use muscles that aren't being active at the moment. So right now my back muscles are pretty soft, and I'm not using them a ton because I've got my torso stacked on its own weight. And I just don't have to worry about trying to balance or hold myself up at various different angles. Other pieces to core workouts, we're also going to talk about the back a little bit. In other videos in this workout series, we already looked at some back exercises with like going into a tilt or a squat and holding something, which is going to really activate your back muscles. So if you want to check that out, go look at some of the other videos in this series. The way that they would have us do this at Mayo Clinic, I don't have the right pillow for it anymore because I was able to kind of go beyond this particular exercise. So I'm just going to use my weighted blanket here a little bit in order to kind of mime what this looked like. I think they called these airplanes. My microphone might get real weird here, so I will not be here for long. Basically, we were on a wedge pillow, but a pretty high one. So it was about this high, and then it went down in a triangle. So then you'd lay on that, and then do kind of like Superman sort of things up. And this is really working those back muscles to shorten the distance between my upper back and my lower back. And it pulls that up. So then you hold that for a couple seconds, go back down, and that's a Mayo Clinic approved back exercise there. If you don't have that particular kind of pillow, like I don't anymore, don't use a weighted blanket because that just didn't feel good. Use like a stack of blankets or something like that. Stack of pillows, stack of blankets, whatever works there. While this is here, let me show you what it looks like. I talked about this a little bit in my video on using household objects for workouts. Here's what it looks like if you're doing crunches with a weighted blanket. Come here, bud. My microphone's gonna hate this, so I'm gonna talk first and then show you. So, this is increasing the weight resistance for doing crunches. And what I'm going to be doing is placing the blanket on my chest and then doing crunches with my weighted blanket from there. This is a pretty beefy weighted blanket. I think it's somewhere around 10 pounds. It is a hefty one. So the reason I like it for things like this is it conforms to my shape and it doesn't like dig in. I don't have to really hold it very well because it's got a nice soft blanket outer layer that gets a lot of nice friction with my clothes. So here's what that might look like. Sorry, microphone. Normally when I do this, I'll be doing it in a sit-up form and I'll have my feet underneath something in a different arrangement of my apartment, so then I don't have to like kick my legs out as I'm doing this. So there's more of a crunch with it. Or full sit-up. So, ways you can increase resistance if you want to. Weighted blankets are great for that. It's like a sandbag. It's really heavy. So, what about planks or push-ups? I'm not going to do a whole bunch of like push-up demonstration because it's actually not very safe for me with how my wrists handle things. I really avoid going to weight bearing at a 90-degree angle. So let me show you an adaptation that I use and then the way that I do planks. All right, so if I'm going to do something like a yoga series of movements where I am in downward dog going into cobra or upward dog. Sorry, I'm rearranging myself here. I forgot to record this, so now I'm going back and making sure that's added in. So if I'm going here, I'm going to, for me and what my wrists need, I'm avoiding a 90-degree angle, so I'm really staying far back with this. And I'm going to keep my elbows back as I go into touch my nose to the ground and then up. So that whole time I was really keeping my elbows back, so that I'm not getting into the kind of pressure that my wrists do not want to take. And then back to here. That is not how you're supposed to do this. This is an adaptation for me in particular because my wrist bones, my little itty bitty guys in here, are pretty unstable with my hypermobility, and 90-degree weight bearing just does not work out well for that. They try to come out of position and I get a lot of pain with that and injuries. So I don't do that very often. I will only do that in that type of yoga series movement, and then I move out of it and go and do something else. What I do hold for a while is planks, but that's on my elbows. So the way that I'm going to handle doing a plank on my elbows is still checking in with my neutral spine. Remembering that my back goes all the way up to my ears. I'm not going to do something like drop my head all the way down or crank my neck back so that I'm trying to look forward. I'm really going to stay quite neutral. I'm not going to make fists with my hands. I found that that is problematic for me and how my hands work, so I'm aware of soft hands. Sometimes I will point my hands out so that I'm kind of forming a little steeple with my fingers and they're just touching like that. So this is the part of my arm that I'm resting on. I've tried a bunch of times having palms flat to the ground, and I don't like it at all. I don't like that rotation of radius and ulna having to wrap around. I end up with wrist strain and elbow strain with that. So maybe for some people who don't have my cartilage issues, it can be fine, but not for me. So I'm really exclusively on the side of my arm, and I'm not putting my palm flat down. The other thing that I've been working with recently has been just because I want a challenge. And I recently had to say, okay, I'm finally done with running. I should not be running anymore. I was getting injured too frequently. So that's a reasonable thing. I'm in my mid-30s now and I have Ehlers-Danlos syndrome. So yeah, running might be out of bounds and kind of off the table for what I need at this point and what my cartilage can handle. So I needed a challenge emotionally. So I've been doing elbow stands up against the wall here. I'm not going to model this because I just don't have a good way to make sure that that's happening safely with the camera and everything. But basically, since I can't do handstands because of my wrists, I can do elbow stands. So what I mean by that is like my elbows are like this, and then I'm up in a handstand against the wall like that. And I have my legs up against the wall. I'm working on the stability in my shoulders to be able to hold that against the wall, and I'm extremely careful about the descent in particular, because if I drop, my joints will not hold themselves in place and I will dislocate something fierce. So very, very aware of the ascent and descent during that process. So that's another one that I've been working on for my stretch goals for my own fitness. Now we're going to talk a little bit about when people say that they really want to be able to stretch the core, how do they do that? Well, it's just increasing a distance. So exercise, for the most part, is going to be about decreasing distances. Stretching is about increasing distances. So how can we increase a distance in the core and the abs, if that's the particular area that we're targeting? We can go into up and back, which is going to increase the distance here on my front side. And I'm going to kind of let my arms hang out, or I can put them back behind me. So this is just allowing that stretch up and out. And then on the way back, I'm going to keep in mind coming back to a neutral alignment in my spine. When I'm going into these curves to allow a core stretch or a back stretch, I'm going to be really mindful about how I'm doing it and how I'm distributing that curve along my whole spine. My back goes up to my ears, and what I'm doing with my head and my neck still really matters. So in my case, I actually can drop my head so far back that my skull rests on my spine. I should not do that, and I'm not going to show you what that looks like, but that's how far back it can go with my hypermobility. It's a bad thing. If you can do that, don't. It's too far. So I'm going to be mindful of that. Just because I'm stretching backwards doesn't mean that I'm going to put my bones in a place where bones shouldn't go. So up and out, and I'm thinking about this as distributing that curve over a long distance so that I'm not putting a kink in a hose at any one particular spot. I'm going to instead be, what I tell my students, be a well-distributed banana. Up and back, lengthening along that curve, and then coming back into my reset. Very similar thing for stretching forward if I want to do that. Not putting a huge bend into any one spot. A lot of people will try to bend forward a lot in their upper backs, which looks a lot like this, and then they say, I don't understand why I'm not getting a back stretch because look, I'm bending my back. Well, you're bending part of your back, you're not bending the rest of your back. So lengthened along that whole curve. is going to allow all of those muscles to stretch out and for my vertebrae in my spine to arrange themselves in a forward curl, and then I can reset back to neutral. So, in summary here, no, I'm not going to tell you what specific exercises you should be doing, because nobody should be telling me what exercises I should be doing if they're not a professional and trained in what's necessary for me and the conditions that I've got. So if you're going to be working with this on your own and figuring out for yourself some things to keep in mind, some guidelines. What you're doing and how you're doing it matters. It's not simply about getting the number of reps in. Your movement and your organization of yourself during something like a core workout still really matters as far as injury prevention and making this sort of thing more sustainable for you. A good workout is one you can repeat. Start there. If you are new to this, if you are trying to find a beginner's level workout and want to make sure that it is in alignment with Alexander Technique principles and ideas, take an online lesson with somebody. It doesn't have to be me necessarily. I'm about to move out of the country and won't be able to give lessons for a while, so find somebody. There's lots of people who can give lessons in this. Any Alexander Technique teacher who is certified and has gone through a full training course can absolutely look at what you're doing with your exercises. Like, tell them you want to bring in your yoga mat and you want to, work on how you're doing your exercises. Any of us can work with that. We're not going to tell you what exactly you should be doing as far as your workout plan and exercises for you, number of repetitions, number of sets, frequency, how often you're doing it. That's not us. What we can look at is your mechanics. How are you doing it? And are we seeing unnecessary strain or potential injury spots anywhere along that line? So I encourage you to get curious about how are you doing something like a core workout, and how can you improve your technique and your use of yourself in that process.